Let's talk a little bit in this video about the insurance authorization process. I've been in practice for almost 8 years, and I have noticed that getting surgeries authorized through insurance has become a little bit more straightforward in some ways, because I think I know what the insurance companies are looking for, what they're likely to deny, and what they're likely to approve. And in other ways, it's become more difficult. I think that insurance companies are increasingly particular about what they will pay for and what they won't pay for. First and foremost, we want to do your surgery if we've recommended surgery. So getting the authorization from the insurance is something that we are trying actively to do. Secondly, our office works diligently to get insurance or get surgeries approved through insurance. They work on it every day. They meet about it every day. There's an entire team. So that's a burden that our patients really don't have, as we take care of the authorization. Authorizations typically take 2 or 3 weeks, and sometimes there are delays for one reason or another, but in most cases it's hard to get authorization for a surgery sooner than 2 weeks. There are certainly certain cases that don't require authorization, like a brain tumor typically doesn't require authorization. Some insurances don't require authorization for a discectomy, others do. So there's a lot of nuance to the whole process. There are certain types of surgeries that some insurances don't authorize. For example, some of the insurances still don't authorize a lumbar disc replacement, although I think it's gotten to a point where they've come under fire for that, and we're getting more and more along the road. But there's just a lot of nuance to the insurance authorization process. What can you do about it? Well, please give us all of the information. If you've done physical therapy, we need to know. We need to know who you did it with, how many sessions. If you've had an injection, please let us know. What over-the-counter medications have you been taking? What aggravates your symptoms? What makes it better? What ways are you modifying your activities of living? What things can you not do because of the problem? These are all things that the insurance companies want to know to prove that the recommended treatment is medically necessary. So if we can gather all of that information and compile your case to the insurance company, we typically have pretty good success. One area that may not be apparent to patients but is important is, say you have a problem for which surgery is likely to be recommended, but you haven't done any physical therapy or had an injection. The insurance company will oftentimes say, well, they haven't done physical therapy or had an injection, so why would we go straight to surgery? So if we're trying to bypass that, we would have to do it for a compelling reason, like a severe foot drop or pain that's completely uncontrolled. But for the most part, patients really have to do a course of conservative therapy before going to surgery, or we really cannot get the surgeries authorized. So consider that in your planning, that if you're coming to us and we're saying, well, we think surgery is probably going to be needed here, but we really are going to recommend an injection and some work with physical therapy. We're saying that in part because we have to have a case to present to the insurance company that says, yeah, this patient really does need surgery. Furthermore, a lot of times problems get better and you're experiencing a flare-up, and a little time and a little therapy and maybe an injection can help settle down symptoms and push surgery down the road or avoid it altogether, which we are definitely a proponent of, because if patients don't need surgery, that's wonderful. So be patient with the process. It is frustrating. It's frustrating when an insurance company comes back and denies a case that we were planning on it being authorized for, and now we have to reschedule. It doesn't mean we don't like you. We do like you. It's just part of the medical environment that we live in, and it doesn't always work out the way we want. Most of the time it does, and we hope that, again, we can collaborate together and work with the insurance company in a productive way to help you get better.